and count down, then Dr. Kamlesh, you can start. Yeah.
Okay.
Okay, sir. So in next 10 seconds, we will start. So, sir, it's 3, 2, and 1. So we can start now. Over to you, sir.
Hello, everyone. This is Dr. Kamlesh Patel, medical head at Lupin. And on behalf of Lupin, I would like to extend a warm welcome to all on today's webinar titled Making Mental Health a Priority for All. This webinar is actually organized under the banner of a campaign, Say Yes to Life, and with the aim to hope for everyone who are dealing with a mental health condition. We actually endeavor at Lupin to come up with this kind of initiatives, which is coined as Say Yes to Help. Say Yes to Life. Yeah, going ahead, without wasting time, I would like to welcome our esteemed panel members. Although none of our panel members need an introduction, but still let me take an opportunity to introduce them to you all. First, I would like to welcome Dr. Hansa Yogendra, who is President, India Yoga Association and Director of the Yoga Institute, a 104-year-old institute and the most recognized yoga center in the world. Welcome, ma'am.
Thank you.
I also welcome Dr. Sunil Mittal, a renowned psychiatrist with more than 36 years of experience. He's a founder and director of Cosmos Institute of Mental Health and Behavioral Science. He's a vice president of World Federation of Mental Health. So, Dr. Mittal, welcome. I welcome Dr. Supriya Hegde Arur, who is consultant psychiatrist, Arogya Clinic, professor and head of psychiatry at Father Muller Medical College, Bangalore. She holds multiple awards in her name. She's a gold medalist from Manipal University, has won Good Teacher Award as well as SS Jairam Award in 2012, and was awarded the Lady Lions Award for Women in Action Health in 2021. Welcome, ma'am.
Thank you.
Now I also welcome and introduce the President of India Region Formulation of Lupin, Mr. Rajiv Sibal. He has been torchbearer in shaping many therapies in Lupin, and his contribution is immense in healthcare. Welcome, Mr. Rajiv.
Thanks.
I also welcome Mr. Vishal Meswani, who is Vice President, Sales and Marketing, Lupin, who has been driving force behind Say Yes to Life campaign and Sarthi initiatives for promoting mental health.
Thank you.
Welcome. Also welcome Mr. Amitabh Pandey, General Manager, Sales and Marketing, Lupin CNS, who has been instrumental in driving all the major initiatives and strategy of Lupin CNS. Welcome, Amitabh.
Thank you. Thank you so much.
And finally, hold your breath, very popular, Hum Sabke Chahite, who has been an integral part of India's music industry for the last 3 decades and crooned more than 3,000 songs. Our very own Shan. Shan has been the torchbearer of Say Yes to Life campaign, and he has joined hands with Lupin to create awareness of mental health. So welcome, Shan, and welcome everyone. And thanks a lot for joining us in a busy schedule in this endeavor to ensure that it's made successful. So to begin with the introduction, I would like to invite Mr. Rajiv Sibal, help us understand why it is necessary to talk about mental health and the idea behind the campaign, Say Yes to Life and Sarthi. Over to you, Mr. Rajiv.
Thanks, Kamlesh. Thanks very much. Good evening, everyone. And I should welcome all of you on my behalf for this session of making mental health a priority. I also welcome all the esteemed panelists for being the part of this endeavor. Mental health conditions are skyrocketing worldwide. According to World Health Organization, the prevalence of mental health condition and substance use have increased by almost 13%. India being the second most populous country in the world, the increase in the prevalence of mental health disorder is drastic. According to a study published in Lancet Public Health, the prevalence of anxiety and depression increased by 35% during the COVID-19 pandemic, and 1 in 7 Indian is affected by mental disorders of varying severity. In addition, approximately 80% of the population diagnosed with common mental disorders experience a treatment gap. The pandemic has worsened the situation with such a mammoth burden of mental illness, coupled with negative perceptions about mental illness and a sheer lack of awareness. It is necessary to talk openly about mental illness. Hence, today's topic of discussion, making mental health a priority for all, is the most appropriate one. Lupin has always been at the forefront to create awareness for mental health, extend support and care to the patient, and to bridge the treatment gap. Hence, for the first time in India, Lupin CNS, banking upon its superior doctors network, has launched a much needed platform called Say Yes to Life Sarthi. This platform is crafted to focus on people's mental health concerns and provide comprehensive solutions to the same. So I think it's time we don't just talk, but take action in the direction of improving mental health. I look forward for a very, very fruitful interaction for the next 1 hour. So thanks everyone for joining on this webinar. Over to you, Kamlesh.
Thank you. Thank you so much, Mr. Rajiv, for setting up the stage for today's discussion. Now I would like to request Mr. Vishal to share the idea behind the campaign, Say Yes to Life. What prompted Lupin to give birth to such a noble initiative? Yeah, Mr. Vishal, over to you.
Thank you, Kamlesh, and thank you, Mr. Sibal, for setting the tone for the meeting. In fact, we are on the eve of the World Mental Health Day, which is celebrated on 10th of October every year. So what a right time and a right platform to talk about mental health, right? We all know that mental health is nothing but a state of well-being. You know, a person with good mental health can comprehend their abilities, can cope up with the stressors of life, work productively, and contribute according to one's capacity. But many a times, people fail to understand that mental health is equally important as physical health, right? In today's fast-moving world, people are more concerned about their physical looks and health, but many times they ignore the mental health and well-being. Hence, mental health is ignored to a great extent. And Lupin, being a socially responsible pharmaceutical company, constantly strives to bring a change in the perception of mental health conditions by educating the common public with the help of HCPs and especially psychiatrists, and removing the stigma associated with mental health through our campaign called as Say Yes to Life. This Say Yes to Life campaign has been going on since last 1 decade, and many activities in terms of patient education has been going on. And we have partnered for last few years with Shan, who has been a great force in helping to spread awareness about mental health. And we are actually today thankful that we have a panel of luminaries who will talk of mental health and how to help people or patients with mental health from a holistic perspective, actually. So we have a panel of psychiatrists, world-renowned psychiatrists. We have the world's best yoga institute and the head of yoga institute there. We have the celebrity singer, Shan, who is going to help understand the scope and role of music therapy. And I am sure today's discussion will be very holistic in giving the right direction to many patients who need help and Sarthi. So we thought that why not we launch our platform called as a Sarthi platform. You know the word Sarthi, it means what? Your guide. Your guide, you know, your coach. So we developed this beautiful platform, which is a very holistic platform. This platform helps your patients to understand the basics about the diseases. Not only that, it also helps you to reduce your stress. And it has got various sections. And one of them is the guided yoga section. which talks about various yoga techniques. Some sections are there which talks about how to improvise the sleep. There's a section on music therapy to reduce the anxiety and stress. There is also a section on breathing techniques to reduce anxiety and stress. And most importantly, I think it's a holistic platform developed in regional languages. So our endeavor really is to partner with healthcare professionals, psychiatrists, and the society at large to reduce the burden of mental health. And I'm sure our this initiative of Say Yes to Life will go in a bit to increase this awareness. Let's together say yes to life.
Thank you. Thank you so much, Mr. Vishal, for explaining in very briefly about Say Yes to Life and Sati initiatives. You have actually joined the dots of well-being, mental health, as well as physical health. So again, the topic for today's discussion, making mental health a priority for all, is in line with World Mental Health Federation theme. To achieve an in-depth understanding, it is important to know the rationale behind the selecting the theme. So it's make mental health and well-being for all a global priority for World Mental Health Day. So to address this, none other but Dr. Sunil Mittal, who is a part of constitution development of World Federation for Mental Health, is more suitable. And I request Dr. Mittal to please throw some light on the same. Over to Dr. Sunil Mittal.
Thank you, Kamlesh. Firstly, I bring everyone here greetings from the World Federation for Mental Health, which is the largest body of mental health professionals, all stakeholders, people living with, having lived experience, caregivers, family, policymakers, and everyone, economists, etc. Everybody who is concerned with mental health. And there I can say that who is not? Each one of us has our own mental health to look after. I also bring greetings from Cosmos Institute of Mental Health and Behavioral Sciences and Caring Foundation, where I work. And I thank Lupin for putting this program together. So this theme, to make mental health and well-being for all, I'm breaking the theme down, to make mental health and well-being for all a global priority. So the way a theme is selected at the World Federation is that ideas are floated, they're narrowed down to 10, they're circulated amongst the member, organizations, and then a theme which is most suitable and relevant to that era or epoch is selected. So this theme has got many parts to it. Firstly, it's not just about any mental disorder, it's talking about mental. And that's a big concern because we need to think beyond just disease and disorders. And all of us owe to ourselves to look after our own mental health. It's also talking about well-being, because mental health is an integral part of well-being. There can be no health or well-being without good mental health. And this expands it, like today in the experts, we have one of the most renowned yoga experts, and we have a celebrated singer, because it goes beyond just talking about illness. And it also has a part which it's inclusive for all, children, adults, old age, disabled, disadvantaged, the north-south divide across the world, and the people which have been shown in the pandemic, in the COVID time, people who suffered. So it's for all, and to make it a priority because it has long been neglected. So that's our theme. This theme has got really advocacy, it's got real fact, and it concerns you and me. It concerns each one of us. Having said this, we know this, that there's an increasing burden of mental health conditions across the world. And like figures have been shared about the increase of 35% during the COVID pandemic. But we know this from our own data in our own country. And mind you, because like Mr. Sibal said, we have a large population. So the figures in totality become staggering. Almost 20 crore Indians require mental health care now. Now that's the official figures, 14% to 15% of our population. But if you put together substance use, the unofficial figure is close to 25 to 30%, 1 out of 4 people, whereas officially is 1 out of 7 people who has got a diagnosable condition. So it's huge. And the manpower shortage, the mental health gap, the treatment gap, which has been referred to as 80%, which means almost 80% do not get any help. And that's one of the concerns that we have. One, of course, is there's a lack of awareness. Even if I'm aware that I have a condition, then I need to overcome my stigma, the discrimination and stigma that one faces. So awareness, stigma. And the third is, even if I did overcome my stigma, where are the mental health service providers? Accessibility of services. And even if I did access mental health services, the affordability, the availability, and being able to sustain it. Our own studies show that almost to implement the new Mental Health Care Act, which talks about the rights of the, we have one of the most progressive acts in the world, which talks also about protecting the rights of people with mental disorders. To enforce it is going to cost 93 lakh crores. It's going to cost 93,000 crores, 1 lakh crore every year. Where is the fund for it? There is no money for it. So we are sitting on a mental health pandemic. For the World Federation, we hosted the World Congress in 2017. Lupin supported that Congress. And the President of India came to inaugurate the Congress, and he said that we are sitting on a mental health epidemic. That's what Shri Ramnath Kovind said, and that we need to do something now. And today there's so much talk about mental health. Now, if you look at some of the figures, it said that between 6,000 to 9,000 psychiatrists, nobody is sure of the exact figure. Let's say 7,000 or 8,000 psychiatrists, which actually comes down to 0.3 psychiatrists per 1 lakh population in our country. What is required is 10 times this. Even if it's 8,000, you require 80,000. We are going to reach there in maybe decades. And if you look at trained clinical psychologists or trained psychiatric social workers, they're 0.07 per 1 lakh population. It's dismal. And that's why it becomes really, really important to make it a priority, for India. And that's why today's the theme for this discussion, the prioritizing it is so, so important. And then, of course, as you add to this, the facilities are not available. People are struggling with their stigma. We did a survey in 7 states in our northern states. We used a newspaper to do. The readership was 27 lakhs. 2.7 crores was the readership, and 27 million. And we got 14,000 responses. And people said, we don't have our facilities available. We don't know where to go. We are struggling with our illnesses. We have to overcome stigma. A youngster wrote, I need help, but my parents don't understand it. An elderly person wrote back saying that, I need help. I'm depressed. I'm suicidal. My son is out working in the Middle East. I need help, but there's nobody to take care of me. So these are individual stories, but there are crores of these stories across. So having said this, what we need today is for each one of us here and each one of us to talk about it, to speak about it, to spread this message, which is coming from this seminar today.
Thank you, Dr. Mittal. You have nicely explained the theme. It isn't, and actually we all agree that it is beyond illness. And of course, you also shared about the latest mental act from an Indian perspective. So it's all about helping and understanding. So now, while we are discussing making mental health a priority, it's imperative to understand the mental health status across different age groups and genders. So if you look at around 20% of the world's children and adolescents have a mental health condition, with the suicide the second leading cause of the death among 15 to 29 years old age. So concerning that, I would like to ask Dr. Supriya, if you have observed any difference in the age group of patients seeking medical care, and what are the signs that we should be aware so that we can identify mental health condition at an early stage. Dr. Supriya, please.
So I would like to thank Lupin at the onset for inviting me to this platform. I consider myself fortunate sharing the podium with stalwarts like Mr. Shan and Dr. Mittal. So the Lupin's Yes to Life campaign is one of its kind, and the Sarathi initiative appears to be extremely, it has a vision. You asked me this question, what are the early signs and how it spans across the lifetime. So one of the major things about mental illnesses that what the brain does not know, the eyes does not see. So if people do not know what are the signs and symptoms of mental illness, even if they have it, they will attribute it to a lot of things, like past karma, magical religious beliefs, and even sometimes, things like being possessed and things like that. So most important thing here is what is their perspective of why this illness came. If you look at small children, we have children as young as 8 to 10 years who develop symptoms of depression. For example, there was a kid who was brought to me, whose mother had died in a unnatural manner. And this child would suddenly wake up in the middle of the night screaming, and he was very disturbed even in school, and his grades began to drop. So, and a child who was quiet and very respectful started becoming defiant, irritable. So sometimes in children who find it difficult to vocalize their symptoms like sadness and lack of interest and lack of feeling lonely, they would probably lash out in behavioral ways, and it's up to the professional to pick it up. But these could be the sign of depression. And in children, it becomes very challenging because sometimes they are labeled as being rude or indisciplined. And it's up to us to convince the caregivers that it's not so and it's a symptom of depression. If you look at adolescents, generally adolescents are very difficult to handle. And the teenage phase, all the parents will be complaining that they don't listen, they bang doors, they are rude, they don't follow any rules, they keep their rooms untidy and things like that. But when mental illness starts in adolescence, it's very turbulent because anyway their hormones are changing, and then they have an illness coming through. If it's a psychotic illness, then there's a drastic change, and you can see somebody who is functioning well, suddenly the grades will drop. Somebody who is participating in multiple activities, and they're not able to do that anymore. And in girls, there could be promiscuity. So that raises a lot of eyebrows that, she is dating multiple boys and things like that. It could be depression. So sometimes these are the things which are not straightforward in children and adolescents and becomes a challenge. In the younger age group, the signs and symptoms of mental illness are pretty straightforward for a trained eye. And if it fits into the diagnostic bracket, it's easy to diagnose even for a normal healthcare professional. It need not be a psychiatrist also. So typical symptoms, wherever we look, for example, if you look at the social media trending these days, for example, if you look at Twitter, a lot of people talk about depression and things like that. But is depression same as normal sadness? Of course not, because if it's a normal emotion, it fluctuates. If I'm feeling low this whole day and I happen to see my favorite singer, it taps up my mood. But in sadness, whatever you do, even if you listen to your favorite song or even if you go to a good movie, it doesn't really pick up your mood, and it lasts for a long time. And it is not situational, or it is not temporary. So that differentiates a normal emotion from a sustained state of illness which happens in mental illness. So there are so many different types of mental illness. It's difficult to say how to recognize the early signs of each. People tend to bracket mental illness that he has a mental problem. But like how there are so many physical illnesses, similarly there are so many mental illnesses, and each one has a different sign and symptom. So the early signs would be to recognize them would be first is whether it is pervasive in the sense that it is lasting for a long time. Second is whether it's disturbing the functioning. So if it has begun to disturb the functioning, it has reached a point where we need to bring it to the notice of a healthcare professional. So early signs and symptoms are different, especially in child and adolescent. It becomes challenging to identify. In adults, it is relatively simpler. At the end, I would like to say about this question is that, it has begun to affect functioning, it definitely requires attention.
Thank you, Dr. Supriya. Actually, you have connected eyes with the brain, highlighting early signs of child as well as adolescence and how it can be recognized. So thank you so much. After having a clear picture of mental health status among the child and adolescents, I assume the scenario in the elderly and working individual will now be different. So I would request Dr. Mittal to share his opinion and experience in dealing with the mental health illness in a working individuals and the elderly? Sir, over to you.
You're right, absolutely, Kamlesh, that it's no different. Mental health disorders are prevalent in each and every age group. Only the nature of the disorder may change. As like Dr. Supriya said, from childhood to whether they're gender or they're elderly, and we know this, that globally about 15% of working age adults, they suffer from some mental disorder or the other. This about 2 decades back, I was working with the International Labour Organization as a national consultant. We were looking at the substance use and alcohol use at workplace. And there was no data for India, but we got data from Argentina that as they estimated anywhere between 15 to 22% loss of GDP occurred due to mental health and substance use issues. And this is 2 decades back. I'm sure with the pandemic and everything, this would have increased. And I'm sure there would be some now data being generated on this. So it's a big economic cost also. So it makes sense at workplace to have policy for mental health. 2 years back, the theme for the World Mental Health Day was mental health at the workplace, just to be able to highlight this and work on it. Now, having said this, we also know this, that a recent survey by Deloitte said that about 80% of the Indian employees reported mental health symptoms. They felt having had some issue of, some varying issue of some sort of mental disorder. In our own work from our institute with CEOs of companies, we found that anywhere between 85 to 90% felt what could be called either a burnout or a sort of a demoralization. That was the term which was used because they were really burning their candle at both ends. Plus, of course, the pressures of corporate life, the stressors, balancing life between home, work, all of us face that. So the costs are high, and the costs are highest not just in terms of physical health, but mental health costs are very high. The quality of life suffers, depression, anxiety, stress-induced disorders, psychosomatic disorders, the commonest being sleep disturbances, and then that sets off a trigger, a cascade of hormonal changes, right, bringing up to obesity, and then we are the diabetes capital of the world, and so on. So the whole spectrum, the mind is no different from the body. Now, with this, the report of if we just went by feeling exhausted, feeling emotionally drained, that would be almost 80-90% of the workforce. Now, that's regarding people who are working. And we can, and it's not just about absenteeism, it's also presenteeism. You could be working, but there is no output. And then with substance use and mental disorders, there could also be the huge costs that the companies or the employers pay, which is in terms of compensations, productivity loss. And therefore, one of the things which I feel from here is that it makes absolute sense to have policy in place in workplaces for mental disorders and substance use. And that I think is very important. Now, the other part of your question was to do with the seniors or the people like me with gray hair who are growing older. So one is that it was sort of accepted, oh, you've grown old, so satya gaye, and and mild cognitive impairment was one set of problems. But depressions, anxiety, and again, figures are the same, 15 to 18 to 20% of the elderly population are likely to have one mental health disorder or the other. And then, of course, is the whole issue of the changing social scenario and landscape, loneliness, connectivity. Those are extremely important factors which are there. And changing family structures.
Yes.
So I always say this, that all of us invest, I or you or anyone else would invest money, invest in shares, invest in the market, invest in property, invest in your children. But do we really invest in our health? I'm not talking in terms of health insurance. I'm talking in terms of health practices. Do we invest? Because what is going to be extended, we all want to live long, is old age. And then when it's the old age which is extended, then what is going to matter is health. And what is going to matter most is good mental health. And we know this, that even our dietary habits, we know this, that exercise habits, the lifestyle habits are linked to the aging of the brain. And today, in terms of neuroscience and neurobiology, we also understand it's not just social factors. It's not just connectivity or family dynamics that change, but the fact that other comorbid conditions with age, diets, exercise, lifestyle practices, yoga, everything plays a role. And with this, I think with, we are a young population, general population, but our aging population is increasing. So we're going to see a huge increase in people, elderly people who have mental health issues. The time to act is now. And then the time to act on that is to create awareness. And for people who are elderly also to seek help. During the pandemic, we were acutely aware of people who were lonely and they couldn't connect. Young people could use, digital platforms. Elderly couldn't. So it's time elderly friendly and environment and ecosystem is created. So I'll just end there. Please, over to you, Kamlesh.
Thank you, Dr. Mittal. So absolutely. So it's all about balancing life at the cost of wealth or health. And of course, you're nicely given a tips for all of us that we should be investing in health practices for a good mental health. So now coming next, talking about mental health is not actually openly accepted, that we all know. And having family and social group who are supportive and understanding helps actually people suffering from mental health condition to fight the situation. So as a person from a showbiz industry, where people are at helm of their success one day and face rejection the next day, it must be difficult to be mentally unaffected for everyone. So we might be experiencing mental health issue in very close family members. And in this regard, I would like to ask you, Shan, what measures do you take to stay positive with the changing dynamic of industry? And how did you support the family members in this kind of situation? How difficult was it to overcome the societal stigma? Shan, over to you.
Thanks so much. I've been all ears listening to our panelists, our esteemed panelists, and there's so much information, so much knowledge that I'm gathering. Even now, even though I feel that, in the last 4 years, on a personal level, I've been able to understand mental health a lot better. Like you mentioned, sir, about, when you are in a competitive or a so-called entertaining industry where you're always supposed to be at the, prime of who you are, people are judging you for the smallest little things. It does get to your, the pressures definitely is not easy to handle. And of course, there are ups and downs, there's success, there's tremendous amount of success. And then there's suddenly there's downfall, and, one has to handle that equally well. On my personal level, I'd like to think that I've been very lucky in that sense that the success has not been enormous, sorry. And the failure hasn't, slumped or dropped me to a level where I really would feel lost, feel troubled, feel frustrated. So, but having said that, certain lifestyle choices that I made very early in life has definitely helped me, cope with whatever the situations are in terms of, keeping my workouts regular. I have a small little, gym room at home. I started very late, but from the age of 32, I've been quite consistently working out and taking care of my physical health. At the same time, keeping a good diet, making sure I get my sleep. So, in that matter, I've kind of been lucky that my lifestyle has supported a good mental health. Yes, I did understand what exactly is mental health or clinical depression very closely when my own wife, Radhika, was diagnosed by it. And it troubled me a lot initially. I thought it made me feel maybe, I'm responsible, or there is something that I may have not understood or done right. And, before that, I was in denial about this whole thing. I thought, it's a very trendy thing, a very in thing these days, especially people who are so successful and yet they complain of depression. It feels, something that they probably are coming from a very entitled space of mind that, if I don't get anything right, I'm going to blame it on depression. Whereas, this country, we are dealing with so many people with so many economic, emotional, so many issues, and they're fighting it. And yet some of the most entitled, or some of the most, loved people complain of going through depression. So I didn't understand that this is not just, there is so much more to it than that meets the eye. But when I started reading about clinical depression, I started reading about medical depression, about mental health, I understood that it's so much more than what we can handle. It's our brain that really controls us. And if our brain decides not to, then it's very difficult for us to be able to handle it, control it. And that's what happened when it happened to my own wife. And today she's in a much better place. She's taken very good care of herself. She's taken counseling. She's taken medication. She's, been constantly upgrading herself, updating herself, reading about things, going for, a little short-term meetings to understand it. And I'm very proud of her, the way that, and I feel today she's in a better place than she was when she was contracted by this disorder. Today, she's in a position where she can actually help other people, talk about it to other people, share her experience. And so when, she came out in the open and spoke about her experience of depression, I thought that, this is a very, very valid cause that one should propagate, one should create awareness of. And that's how I created a song, which was literally what she was going through. And I put it to words and I put it to music. And I'm glad that today, I'm being able to talk with such a illustrious panelist of people who know this much closer than, much better than I do. But I'm just a part of this, and I'm very honored, very privileged. And I hope in whatever little way I can, I want to create more and more awareness towards clinical and mental depression and mental health.
Thank you. Thank you so much, Shayan. It's really motivating when you say that your wife has come up from one area to another area, which is actually now in the era of helping to other people. That's really motivating.
That is true.
As you say that it's all about making choice in the early life, correct? And
that is true. And the things that she has read and the things that she shares with me, though I may not be a typical case of mental health issues, but it applies to all of us. It applies to all of us who want to change, who want to evolve, who want to grow. And things like you don't lie, you respond, you hold on to your thoughts until you're sure about how you want to interact and how you want to deal with it. And so many things that she tells me that helps even regular people. So I think when we talk about mental health, we should not only keep it very pointed towards people who are going through a serious, depression, but to just generally people can gain so much by making sure that their mental health is at its optimal, and it can make them just better human beings, better people, more compassionate, more understanding, and live, more fulfilled lives.
Thank you. So you not only control your brain, but also family. Thank you so much. So as we are responsible member of society, should actually change our perception. That's a message. And for that, I would like to ask Dr. Hansaji, how can we make the lives of people dealing with mental health condition easier, and what measures should we take? Dr. Hansaji, please.
First of all, I am enjoying all this discussion, and Dr. Mittal has touched with all the important points. And basically what Shan said, that is so important, that you are not just stuck with your own problem and pain. You start seeing the problems of others and your problem becomes much less. And then you start helping others. What you know, you go ahead and teach. What you don't know, you learn. Learning is so important. In yoga, they say that a person, if person is away from happy state, he is not healthy. He has to take care. And we people suffer more at mental level, not at physical level. Physical level, pain and suffering, they come and you attend to it and it goes. But mental, it's a big thing. Person gets hurt by somebody, that hurt will remain with him for the whole lifetime, unless he knows how to handle that. So we have to educate every human. We get sick or not sick, but every human goes away from a happy state, sometimes or others in life. And he should definitely train himself. Yogis say, human mind, because it is highly developed mind, it needs training. If mind is not trained, According to situation, mind will function. Problems are there, so you go into depression. Things are better, you feel a little happy. This is not the way mind should go. Where the mind goes, that part in our body also becomes active. And that creates the problem. So we have to train our mind thoroughly well. That's what yoga strongly says. And so yoga has its own psychology. Yogis say that every human should know that he is a unique person by itself. I should uplift myself. I should know that I have all the capacity. I have my body, my mind, and my soul. And soul has tremendous capacity, which I have within me. And so never put yourself down. Don't compare yourself with others. Others are different. You are different. First of all, we all should know this. Comparison is wrong. How we have accepted animals as they are. Dog is dog, cat is cat, donkey is donkey. Dog is going to bark. You can't expect dogs to stop barking. Now, why can't we accept every human as they are? Every human is different. And we have to learn to accept every human as they are. And whenever every human, when they behave in a particular way, now how dog barks. Now, every human also can shout sometimes. You don't have to get hurt. You have to just understand what he wants to say and do what you have to do at that time. So what this requires is a training of mind. We need to see things as they are. We need to respect every human as he or she is. And we need to know that if somebody is behaving in a particular way, he is justified for his behavior because he is in that state right now. So this whole overall understanding about life, how to think, yoga talks about. Yoga says how to live, how to think. And that's where I always personally feel that right from childhood, yoga, as well as music, has to be there in every human's life. Every human's life. Person must learn how to sing. Person must learn, at least become a bathroom singer, so that whenever he finds his mind little upset, he knows, come on, start singing something lovely and his mind comes up. Person must know how to handle his emotions. So right now, if my emotions are getting little disturbed, I should become aware about it. Don't allow my mind to go so difficult that then it becomes uncontrollable. Right in the beginning, we should handle that. Yoga is a science of awareness, culture of consciousness. Aware, become aware of yourself, that how my mind is right now. Oh, this fellow is very irritating. I'm getting little disturbed now. I should be aware. Let me take few deep breaths. Let me, if I can go out, let me go out and munch something and feel little happy. I have many choices how to handle that temporary irritation, which I should know. And I should do it and not allow myself to go into such a bad state that I would react. We have no right to react. We have to act at a right time in a right manner. So all this training yoga gives, yoga psychology. Yoga has a very big subject. It's a holistic subject. So yoga talks about psychology. And here I find that every human should first love himself, respect himself, uplift himself. If I am sad, it's my responsibility to do something about myself. And I don't depend on somebody for that. I should become self-reliant myself and see that I don't remain in negative state for a long time. These are many things. Now we don't have much time. The point is very clear that we need to train. Do you know what happens when human mind is not trained? Mind's job is to think. So mind is going to think. If you don't tell your mind to think in a particular way, then mind goes usually in past. Because you have lived your past. So mind goes in past and then you suffer again and again because of your past. Or mind will go into future, anxiety, tension, worry, what will happen and all that nonsense. Mind is supposed to remain in present. So give some subject to your mind to think and your mind would function very well. So we have to slowly train our mind to learn to live in present, not in past or future. That when you are using the word Sarthi, this Sarthi word, when it comes in the mind, that's the Lord Krishna. He was a Sarthi of Arjuna and how he guided him. Krishna told Arjun, that you are thinking about what will happen. Stop all that. Wise people don't think about past or future. Right now, what you are supposed to do, pick up and start doing your duty. So that was the first message given from in Bhagavad Gita. So try and go through this whole thing. Person has to take charge and go ahead in life. Yoga technology is there, which works wonders. Certain techniques would quickly uplift your mood. Certain techniques would try to relax every cell of your body. And these simple techniques, which we have to learn. Dr. Mittal was very much worried about how the cost and all that of all these treatment. But I would say yoga doesn't need much cost, this education, right from childhood. And that education everybody must have. And if person finds that no, things are going out of control, he just cannot do anything for himself, then then he can take definitely help of psychiatrists and all this whole area. And he may need some chemicals, so he may take some, but then you have a responsibility to put yourself in a good condition. Don't allow things to go so bad. And if it has gone bad, do something. We to teach them sudden death in a family. Dear husband died, no clue. Now people will definitely go into depression, sit and cry and all that. But we say, come on, cry for 5 minutes, then pick up, then start doing your responsibility, duty. What is my duty right now? Husband died. Children are also suffering. Everybody is suffering in the house, that loss of some important person of the family. Now, what is your duty right now? So I tell that lady who comes, said, your duty is right now to maintain your own balance, accept situations as they are. You can't alter it. So now take charge. So many things are there to be done when person dies in the family. Start doing all those things and give solace to others. Kisi ko pani chahiye, somebody needs medical help, give help. Do all that. Go ahead in life. We always believe that when mind is disturbed, body should take over. Body should take over means physically be active. Chalo, do this, do that, and keep yourself a little bit in control. So there are various ways in which the proportion of problems, accordingly the proportion of its solutions, and various things are there which we could help people with.
Thank you, Dr. Hansaji. You have actually touched upon uplifting our own body and soul with hidden tremendous capacity inside, keeping aside all this comparison. And of course, you have given a mantra that how to live, think and sing wherever you are, even in a bathroom. Yeah. So thank you so much for making us realize our responsibility as a society towards prioritizing the mental health. And in this regard, I would like to ask Dr. Supriya, what measures as an HCP, as HCP can take in hospital settings to reduce the stigma associated with the mental health? Dr. Supriya, please.
So there is obviously a lot of stigma about mental health, and most of it stems from lack of knowledge. So if you look at our medical curriculum of the undergraduate students, there's hardly much of psychiatry. So if psychiatry was made a paper in which these kids had to read psychiatry, probably they would understand that there is much more to depression than just being weak-minded, which it's a chemical imbalance. There is a serotonin imbalance. And how, if there is hypertension, we can measure the BP and say, see, your BP is 180 by 100, you need antihypertensives. There is no way that serotonin can be pulled out of the brain and said, listen, you have a serotonin imbalance, take antidepressant. So many a times people are labeled because of lack of knowledge, which stems from lack of training. So one of the things that could be done is in the undergraduate curriculum to make psychiatry more substantial in terms of questions that is asked in medicine paper. Another thing that could be done is during internship, psychiatry rotation should be compulsory. So if they come and they need, and many of these children, they do come for 15 days and 1 month, but it should be made more so that they get exposure. 30% of all people attending medicine OPDs have psychiatry problems, but they get labeled as somebody who is not strong. But like Dr. Hansa was saying, the remedy to anxiety is action. But all in in depression or in psychosis, what happens, it reaches a certain threshold in which the chemicals take over. So first, it's important to, yes, ma'am. So it's important to make the patient reach a point where he is able to, take action into his own hands. Otherwise, it will be, they go into a negative spiral. So at that point of time, a chemical from outside does wonders. And that knowledge first has to go to the healthcare professionals. So even amongst my colleagues, sometimes, when they give a psychiatry reference, they'll say upper story problem. So it is sometimes, and I will give if it's a junior, I will give a piece of my mind. But if it's a senior, sometimes I just don't say anything because I think it's reached a point where it's difficult to mold. But if you understand that there is a chemical imbalance in the brain, and I'm sure with time there will be biological markers which will be easily available to give proof that there is a problem. So the proof of the pudding is in eating it. So once when people see that there is a problem and that is causing the symptom, the healthcare professionals will be easily trained. So to make things get better for psychiatry, first is education system to include more of training in psychiatry. The textbook should be worded a little differently. If you read some of the medicine textbooks, the way psychiatry is described is not exactly that it should be. And even insurance for that matter, if you look at a lot of insurance companies, they reject psychiatry disorders. So many a times when I go for IP references, I'm billed OP, like I'm billed outpatient. Because if my name is included in the IP, then that insurance will get rejected. So these are the main policies which have to start at that level if mental health has to become mainstream. And people who are suffering, they are suffering half because of stigma, which stems from lack of knowledge and lack of action.
Thank you, Dr. Supriya. And actually, as rightly you have suggested that we should be, as a healthcare professional, we should be a trendsetter in abolishing that stigma.